Governor of Louisiana, who is gracious enough to join us today. I will say throughout his campaign for governor, Governor Landry was extremely interested in understanding the challenges of hospitals and always challenged us with questions about how we can make our health system better. We had a number of really positive meetings with him and his team, and he's, since becoming governor, has really been able to assemble a great team at LDH under Dr. Abraham's leadership. I think you'll see they bring a tremendous amount of expertise and I think really focused on provider engagement, which we as providers, obviously, and the physicians who work and nurses who work in our institutions look forward to providing that input. So without further ado, I'm excited to introduce and welcome Governor Jeff Landry to join us today. Thank you.
Thank you, Paul. Certainly do appreciate it. I want to make sure that everyone, if you have Jeremy Alfred's cell number, make sure you text him and say that I'm a much better speaker than him. I know he had COVID, and Jeff calls and says, "Oh, Jeremy has COVID. Do you think you could say a few words?" And I said, "Well, I don't normally like to say a few words. I like to say a lot of words." I certainly want to recognize the First Lady who's here today. She threw an unbelievable event. So that she makes me look so good as I go around, and certainly thank. And of course, Dr. Abraham was able to accompany me. I think we've got one of the best secretaries of Louisiana Health. And I really am excited, and I know that there are some of you in the audience today who were part of the transition committee that we had put together, and I want you to know how much I appreciate the time that you all spent during those months helping us, really try to hone in on the problems that we have here in Louisiana. And boy, we know we got a lot of them, right? But we got a lot to do as well. And I really believe that those committees are really going to continue to work, and we're going to really continue to rely on you as we move through this year and the next 4 years, so that at the end of the day we have better health care outcomes for the citizens of the state, right? I mean, that's the goal. When Jennifer called and asked me to come and talk in place of Jeremy, I didn't have a lot of time to prepare my remarks. And I thought about what we could talk about, and like I said, we've got a lot of problems, we've got a lot of things that we could talk about. But I know that there seems to be an 800-pound gorilla in the room, or an elephant, that is coming real fast. And I know it is on many of your minds, and that is the Blue Cross Blue Shield acquisition, right? Yeah, I see all the heads now. Yeah. I like when the audience is very interactive. I mean, when you're sleeping. There's a different nod when you're sleeping. So I wanted to take a moment, and I want to start by saying, I'm not here to tell you whether it's a good deal or a bad deal, whether the deal should be approved or not approved. But I do believe that we should recognize the landscape of where we are. When this deal first came to light, it was problematic. Okay, and I do believe that if we would have not stepped in, we certainly would not be in as much control of this deal as we are today. And I think that certainly needs to be recognized. And when we had an opportunity to inject ourselves, we worked extremely hard so that if the policyholders decide, because they get to vote, and then if they decide no, well, we go back to whatever the landscape's going to look like. If they decide yes, then the Commission of Insurance has to make some decisions. But let's talk about what this looks like. How you all agree, by show of hands, that we have an outward migration problem in this state? Right? Anybody who does not have their hand up, please see me. Okay? Of the people who are leaving this state, do y'all believe that the people who are leaving this state are Medicaid beneficiaries? Okay, right. Are they the working poor? Yeah. They are the people that many of you and our networks rely on to be able to support the other services, right? We understand this convoluted healthcare system that we're in today. And so every time those people leave the state, they put pressure on the healthcare insurance industry in this state, because healthcare is actuarial, it's based upon numbers. And the less payers, the higher the rate has to go. Okay? And so we know that we have a health insurer here in this state, a nonprofit policy-owned insurer who has been pretty solid since 1990, because I don't know if any of you all remember, but Blue Cross went through a pretty rough time in the early 90s where the state almost had to bail them out. They went into receivership. Okay? We certainly don't want that. I don't want that to happen on my watch. But they control a very large portion of the insurance portfolio, which places them in a precarious situation of running afoul of antitrust positions. And at the federal level, the antitrust policies, not to get into the weeds too much, how many lawyers we got here? By show of hands. It's good, you probably got about 3 too many, but if you don't understand what I'm saying, go see them. Because at the federal level, the antitrust doctrine has been watered down to a consumer welfare position by the United States Supreme Court. At the state level, each state, after Sherman, adopted their own. And many states have not adopted the consumer welfare position. And so you see what Blue Cross went through in St. Landry Parish, and an antitrust deal cost them $300-400 million. All right? So they're caught between the state and federal. Now, if you're a larger insurer, like say United or Humana or one of the other ones, to sue them for antitrust practices, you would go end up in federal court. You wouldn't end up in state court. So there's a legal dilemma that the Blue Cross company is caught in. Okay, I'm not advocating for them, I'm just giving you the facts, right? And so, and then at the federal level, one of the things that allows industry to operate, say like a Cajun Contractors or a LHC, or larger companies that span multiple states, what those companies look for are policies that transcend state lines, right? So that's why you see the United, the Humanas, and why you see the Exxons and the Chevrons and those folks in bigger companies use the bigger insurance players, because they can send their workers in different states and the policies work from state to state. Is that fair? I know I'm painting with a big brush, but I'm just trying to give you a couple. So we're at a disadvantage here in Louisiana, okay? Because when that makes those big companies that we try to attract in the state, they're only going to be looking for companies that are operating primarily outside. And so that puts us at an economic disadvantage. And so, if you think about the antitrust position that Blue Cross is in, if you think about the fact that they're also an antitrust multi-state litigation at the federal level that deals with transcending across state lines. If they lose one or two of those cases, we are going to pay. Make no mistake about it. Now, all of y'all have seen all of the ways that healthcare has changed over the last, let's just say 10 years, right? It's changed a lot. Everybody agree with that? How many of you believe that if this deal doesn't go through, that in 4 years or 5 years, Blue Cross is going to look just like it looks today? How many of y'all believe that? How many of y'all believe we could continue to operate it? Like, I don't know that. But just, again, like, because when I talk to those in the healthcare industry on the provider side, they tell me the same thing. So, if we know that the world is changing fast around us, if we know that it's going to look different, the question is whether we want to ride the wind and hope that wherever it lands in 5 years is productive for us, or whether we want to try to control our destiny. Okay? Now I get it. I'm not telling you I like any of these deals. It's kind of like this bridge in Calcasieu I had to go do. It's kind of like redistricting that I had to go do. I seem to be one of those people that always have to deal with the things that nobody else wanted to deal with, but when I get there, at that point in time, the clock has run out. Right? So let me tell you what I do know. Let me tell you what we have done at this particular point in time. If the policyholders decide to approve the acquisition, and if the government decides that it then wants to stamp the approval, they can do it three different ways. We've got three choices. Tim tell us three choices. He can say no, okay, and we don't know what that looks like. He can say yes, and we know somewhat of what that looks like. I'll now explain that. Or he can say yes with certain conditions. Right? He has that power, not me, but he does. That's important to recognize. I know y'all think that the government in the state does it all. I don't do it all. She tells me exactly what I can do, right? But I don't. We share that responsibility with other state laws. He can condition. And I think that that's important, because this is where you get an opportunity to have your voice heard, so that you can tell us what kind of conditions you need in order to create the stability in the market that we all need, so that we don't have uncertainty. And so, what I would like to do, what I'd like to offer y'all, is Dr. Abraham. I mean, not as a sacrificial lamb. But in talking to Dr. Abraham today, we're going to send y'all a letter. I mean, that's the formality. But I would like, he is going to put together a small listening task force inside of his LDH that we want y'all to go to and list out 3 things that you think need to be conditioned upon, so that we can share them with the insurance commissioner and see what we can get in there, so that if, and I'm not going out there promoting the policyholders to approve the deal. I want you to know that. I'm not getting involved in their election, for or against. But if they do approve it, to me, it would be a dereliction of our duty not to prepare. Right? Is that not fair enough? So if y'all would visit with him and let him know what y'all think we could accomplish in that, I think that would help us. Also, to land the plane if we end up having to put it on a runway. But let me tell you what else we're going to get. When we first got this deal, there was some foundation that was set up in Delaware that they were going to drop $2 billion+ into, that was going to be a C4 that could engage in political activity that could go out and basically compete against almost any healthcare foundation in the state. And I mean, look, if you gave me $2 billion, I could have a lot of fun. But we said no. And that's not what's going to happen if this is approved. What is going to happen if it is approved is that there is going to be a public-private trust. Okay, we actually got to go in and adjust the laws of our state, which I think in a way that might make it attractive to other opportunities like this. It's kind of like where everybody wants to go to Delaware for corporations. We may create a very special public-private trust doctrine, where that money is going to be deposited in that trust. And that trust, inside of those trust documents, has 4 lanes, if you would, has 4 issues that money is going to be implemented or going to be geared towards. The first pillar is going to be to move people from dependence to independence. In other words, we are going, if this is approved, we're going to be able to have an organization out there that is going to work towards trying to move those who are on the medicated rule or in the working poor to help them get private insurance. So that creates more competition, more opportunities for other insurance companies to come in to the state. That should help all of y'all, because at the very beginning of the speech, y'all told me y'all could have a room full of private payers, y'all would take them, right? Okay. Then the second thing that they're tasked with, that this trust is tasked with doing, is improving the healthcare outcome of a chronic disease, okay? And we try to really bracket them. We try to really tighten it down because we got a lot of chronic diseases in this state. But we want them to focus on 1 or 2 so that we can move the needle. Like for me, it's diabetes 2. Because I know that if we move the diabetes needle just a little bit incrementally, the savings to our Medicaid program and to our overall healthcare industry are huge. Do you all agree with that? How about this? Okay. Then the third, so we're working on that. We're working on moving people from dependence to independence. Then the third is working to improve the healthcare workforce in the state. Okay? I did not say the universities. This is the workforce. These are the people that y'all have told me during the campaign you need so desperately in your hospitals, in your clinics. And so they will have money that is going to be directly attributed to working to improve our workforce. Because I'll give you an example about the kind of things that we usually do in this state and what would have happened had we not stepped in. Because this almost happened. And the first, am I okay? I got to do it. Y'all want me to wrap up? Or okay. That means I got everybody's attention. Keep you guys. I'll give you an example. When they first announced that there was going to be a $2 billion pot, I got a call saying there's a university that wanted $150 million to build a research center or a healthcare outcome center. I said, well, that's nice. How are you going to fill it? How many people, you spend $150 million on this big old building, how many people are you going to employ in there? The guy said, well, I don't know, maybe 800? I said, oh, 800 people. How many are going to be professionals, like doctors? Oh, I don't know, professionals, there's maybe like 200-300. I said, okay, what about the rest of the people? 500 people. I said, where are you going to find them? Like, where are the people that you need to fill the hospital or the research center that you need? We don't even have them today. I know that because I went around the state and everybody told me they can't find those people. So what good would it have been for us to take $150 million and employ it in a brick and mortar facility that we cannot fill. You see what I'm saying? And then, of course, then it would be competing against you for that same workforce. How about we take that money and employ it helping you solve your workforce problem? Huh? How about that? And then the last thing that this trust is tasked with doing. And of course, you know, some of the crime is mental health. How many of y'all believe we've got a mental health crisis in the state? Yeah, we're working on that. Dr. Abraham and I had breakfast this morning with some folks. But the last is optimizing government performance. That's three big words, right? But I'm going to give you an example of what I'm trying to do, because y'all may have heard me when I talked to you earlier. We want our safety net programs to work in sync. I'll go back to diabetes too. Dr. Abraham has a patient he's been seeing probably since she was a child, or he was a child. Comes in by 55, 60 years old. Got diabetes too now, right, Doc? Doc pulls out all those great brochures that LDH puts out for hundreds of millions of dollars and all kind of colors and fanciest stuff you ever see. I mean, slick. And he says, Mr. Smith, Ms. Boudreaux, you got diabetes too. If you could lose a little weight, quit smoking, have a healthier diet, I think we can get that under control. How many doctors in here? Right? How many doctors? Am I right, Doc? Okay. Here's the little brochure that tells you about all that. She says, I know she never lied to a doctor, right? So in all good faith, she tells Doc, sure, no problem, Doc. She puts it in her purse. She leaves there and she goes to Piggly Wiggly. Doc? And she goes down the aisle to the soda, to the chips, to the cookies, and then she goes to the cash register with the Louisiana purchase card, with the food stamp card. So in other words, while she has the document that Doc is giving her, telling her what she needs to do, you can do this for me. You can give this speech. Right? Right, Doc? I see you, Doc. Doc, we need a phone. Okay? She's going to try with us. But how about if we had an organization that helps the government starts to integrate the food stamp program with LDH, so that maybe instead of Doc giving her that fancy brochure that she forgot about, it probably got hidden under her cigarettes, okay? He says, guess what, Ms. Boudreaux? If you do these things, you can get $100 more on your food stamp card. And if you continue to do those things, we can actually pay for more, right? And so now all of a sudden, we've got a pot of money that maybe we can utilize in a way that starts to improve the healthcare diets. Instead of spending $100 million printing brochures that are at the bottom of the purse, right? Where are we going to get that opportunity again? That's what I want to know. I don't know. I don't know that we can have that opportunity. But those are the things that we did. We have renegotiated this deal so that we took care of patients, so that we took care of policyholders, and at the end of the day, we also took care of providers. Now, is it perfect? No. No such thing as that. Is it a good deal? I don't know. But what I can tell you is that if we got to deal with it, if that's what the landscape's going to do, I would rather put you all and us in control than to basically ride the wind of what may happen if it doesn't go through. Is that fair? So look, in closing, I'll tell you this. I'm not telling y'all that y'all gotta like this. All right? I don't like it either. I didn't like it either. But it's a much better deal today. If the policyholders agree and if the insurance commissioner thinks it's a good deal. And if y'all would please just get with Dr. Abraham, you got to do it quick. What's the date? Wednesday? Friday works good for him. getting some water off the new budget. But seriously, if y'all would please work with him, come up with that list. Let us try to hammer out a couple of conditions that help to ensure some certainty in the market over the next few years as we navigate this opportunity, okay? As we navigate this challenge. And here's what I'll tell you. We do that, we get through this, and then we start improving healthcare outcomes. And then we start improving our whole economic outlook, because we've got a great opportunity in front of us to bring jobs to this state, to retain jobs in this state, to keep good people in this state. I can promise you, in 4 years, that landscape's going to be a whole lot prettier than it is today. So again, thank you, Paul, for your time. I really do appreciate it. Look forward to working with you.